If you're over 60, there may be something in your bathroom cabinet right now that's quietly putting stress on your heart. Not a rare drug, not an experimental treatment, but medications millions of seniors take every single day, often without a second thought. Pain relievers for arthritis, stomach pills for reflux, cold medicines for a stuffy nose, even supplements many believe are completely safe. As a cardiac surgeon, I've seen patients with hearts damaged not by disease, but by medications they trusted for years. These drugs work. That's why people take them. But after 60, your heart changes. Your blood vessels stiffen. Your ability to handle fluid, pressure, and stress declines. What was once safe can slowly become dangerous. In this video, I'll walk you through the most common medications that may be silently weakening seniors' hearts and what you need to know to protect yourself. This isn't about fear. It's about awareness and keeping your heart strong for the years ahead. To understand why these medications become risky after 60, you first need to understand what happens to the aging heart. When you're younger, your heart is flexible. Your blood vessels expand easily. Your kidneys handle extra salt and fluid without trouble. If a medication puts a little extra strain on your system, your body usually compensates. But after 60, that margin of safety shrinks. Blood vessels naturally stiffen with age. The heart muscle becomes less elastic. The kidneys are slower at clearing excess fluid. Blood pressure becomes more sensitive to small changes. This means your heart is already working harder just to maintain normal circulation. Now add medications into the picture. Many common drugs increase fluid retention, narrow blood vessels, or raise blood pressure even slightly. In a younger person, that may not matter. In an older adult, that extra stress can push the heart past its limit. This is why two people can take the same medication with very different outcomes. One feels fine. The other develops swelling, shortness of breath, irregular heartbeat, or sudden fatigue. Another critical issue is polypharmacy, taking multiple medications at the same time. Many seniors take drugs for blood pressure, diabetes, cholesterol, pain, and digestion. Each medication may seem harmless on its own, but together they can interact in dangerous ways. Some drugs cancel out the effects of heart medications. Others quietly raise blood pressure. Some interfere with mineral absorption that the heart depends on to maintain a steady rhythm. The most dangerous part? These changes often happen slowly. There is no sudden warning sign, no sharp pain, no dramatic collapse. Instead, the heart weakens gradually until one day symptoms appear or a serious event occurs. This is why it's so important for seniors to understand not just what medications they take, but how those medications affect the heart specifically. And now that you understand why the aging heart is more vulnerable, let's talk about the first and most commonly used group of drugs that can quietly overload it. Let's start with the most common medications found in nearly every home, pain relievers known as NSAIDs. These include drugs like ibuprofen, naproxen, and diclofenac. Seniors use them for arthritis, back pain, knee pain, and everyday aches. They work well. That's why they're so popular. But here's what many people don't realize. After age 60, regular use of these medications can quietly overload the heart. NSAIDs reduce pain by blocking inflammation, but at the same time, they interfere with chemicals that protect your kidneys and blood vessels. When this happens, your body begins to retain salt and water. Think of your heart as a pump. If there is suddenly more fluid in your bloodstream, that pump has to work harder with every beat. A younger heart can usually handle that extra load. An aging heart often cannot. This is why some seniors notice swelling in the ankles, sudden weight gain, shortness of breath, or unusual fatigue after taking these medications regularly. There's another problem. NSAIDs can also raise blood pressure and narrow blood vessels. Even if your blood pressure has been well controlled for years, these drugs can push it higher sometimes without obvious symptoms. Worse still, NSAIDs can reduce the effectiveness of common blood pressure medications. So you may think your treatment is working while your blood pressure is quietly climbing. The risk increases with higher doses and long-term use. High-dose ibuprofen, especially taken daily, has been strongly linked to heart failure and increased risk of heart attack and stroke in older adults. Some NSAIDs appear riskier than others, but no option is completely safe when used regularly after 60. And here's something that surprises many seniors. If you take low-dose aspirin to protect your heart, certain NSAIDs, especially ibuprofen, can actually block aspirin's protective effect if taken at the wrong time. So what should you do? This does not mean you must live in pain. The key is lowest dose, shortest time, and always discussing long-term pain management with your doctor. In some cases, safer alternatives like acetaminophen, topical creams, or physical therapy may reduce the need for daily NSAID use. Now that you understand how common pain relievers can quietly strain the heart, let's move on to another group of medications many seniors take every day, drugs prescribed to protect the stomach. Now let's talk about a group of medications many seniors take every single day, often for years, without ever questioning them. I'm talking about proton pump inhibitors, or PPIs. These include drugs like omeprazole, pantoprazole, and lansoprazole. They're commonly prescribed for acid reflux, heartburn, or to protect the stomach, especially if someone is taking pain relievers. And at first, they seem harmless. They reduce acid. Symptoms improve. People feel better. But here's the problem. Stomach acid is not just something to get rid of. It plays a critical role in absorbing key nutrients your heart depends on, especially magnesium. When PPIs suppress stomach acid long-term, magnesium absorption can drop dangerously low. Magnesium is essential for maintaining a stable heart rhythm. It helps coordinate the electrical signals that keep your heart beating regularly. When magnesium levels fall, the heart becomes electrically unstable. This can lead to palpitations, irregular heartbeat, dizziness, and in severe cases, dangerous arrhythmias. Many seniors never connect these symptoms to their stomach medication, but the risks may go even further. Multiple observational studies have found a concerning association between long-term PPI use and increased risk of heart attack. One possible explanation is that these drugs may reduce levels of nitric oxide, a molecule that helps blood vessels stay flexible and open. When blood vessels stiffen, the heart has to work harder, increasing cardiovascular risk. There's also an important drug interaction many people don't know about. Some PPIs can interfere with medications prescribed after heart attacks, making those life-saving drugs less effective. Another major issue is duration. PPIs were originally designed for short-term use, typically 4 to 8 weeks. But many seniors are told to take them indefinitely without reassessment. If you've been on a PPI for months or years, do not stop suddenly. That can cause rebound acid and worsening symptoms. Instead, the right step is to ask your doctor important questions. Do I still need this medication long-term? Can the dose be reduced? Are there safer alternatives? Should my magnesium levels be monitored? Understanding how stomach medications affect the heart is critical because many seniors take them alongside pain relievers, compounding the risk. Next, we'll look at a group of medications people rarely think twice about, yet can dramatically raise blood pressure and strain the heart, common cold and flu remedies. Now, let's talk about medications many seniors take without hesitation, cold and flu remedies, especially those used for nasal congestion. These products often contain ingredients like pseudoephedrine or phenylephrine. They're marketed to help you breathe easier by clearing a blocked nose. And they do work, but what they do to your heart is rarely explained. These drugs are vasoconstrictors. That means they narrow blood vessels. In your nose, this reduces swelling and opens your airways. But once swallowed, the medication doesn't stay in your nose. It travels through your entire bloodstream. That means blood vessels throughout your body begin to tighten. When blood vessels narrow, your heart has to pump harder to push blood through them. Blood pressure can rise quickly, sometimes dangerously, especially in older adults. At the same time, these medications act as stimulants. They can increase heart rate and make the heartbeat irregular. For a younger person, this may cause mild jitteriness. For a senior with an aging heart, it can trigger palpitations, dizziness, or serious rhythm disturbances. This is particularly dangerous for anyone with high blood pressure, heart disease, or a history of stroke, even if those conditions are well controlled. One of the biggest problems is availability. These medications are sold over the counter, so many people assume they are completely safe. They're taken without reading warnings, without consulting a doctor, and sometimes in combination with other heart-affecting drugs. In recent years, health agencies in several countries have raised concerns about these decongestants because of their powerful effects on blood vessels, including rare but serious complications involving the brain and heart. For seniors, the safest approach is often to avoid them entirely. Fortunately, there are safer alternatives. Saline nasal sprays help clear congestion without affecting blood pressure. Humidifiers can reduce irritation and improve breathing. Nasal corticosteroid sprays act locally and don't constrict blood vessels throughout the body. Relieving a stuffy nose should never come at the cost of a cardiac emergency. Now that we've covered pain relievers, stomach medications, and cold remedies, let's move on to a group of drugs that affects not just mood or pain, but also blood pressure, heart rhythm, and fall risk in older adults. Next, we'll talk about older antidepressant medications and why they require special caution after 60. Now, let's discuss a group of medications that many seniors don't realize can affect the heart: older antidepressants, known as tricyclic antidepressants. These include drugs like amitriptyline and imipramine. While they were once commonly used for depression, today they're often prescribed to seniors for chronic nerve pain, sleep problems, or conditions like diabetic neuropathy. They can be effective, but they come with important cardiovascular risks in older adults. One of the most common problems is orthostatic hypotension, a sudden drop in blood pressure when standing up. Seniors taking these medications may feel dizzy, lightheaded, or unsteady when they rise from a chair or bed. This greatly increases the risk of falls, fractures, and head injuries, events that can be life-changing after 60. But the risks don't stop there. Tricyclic antidepressants can also increase resting heart rate, forcing the heart to work harder even when the body is at rest. Over time, this constant strain can weaken an aging heart. More concerning is their effect on the heart's electrical system. These medications can slow electrical conduction in the heart, increasing the risk of dangerous rhythm disturbances. On an ECG, this shows up as changes that are linked to a higher risk of serious arrhythmias, including those that can be life-threatening. This is why tricyclic antidepressants are no longer considered first-line treatment for depression in older adults. Newer medications are generally safer for the heart. However, because these drugs are still used for pain management, many seniors continue taking them without regular cardiovascular monitoring. If you or someone you love is taking one of these medications, it's important to ask the right questions. Is this still the safest option for me? Have newer alternatives been considered? Should my blood pressure and heart rhythm be monitored regularly? Treating pain or mood should never come at the expense of heart health. Now, we come to the final and most controversial category on this list: a supplement millions of seniors take daily, believing it protects their bones, but which may pose hidden risks to the heart. Next, we'll talk about calcium supplements. Now let's talk about one of the most commonly used supplements among seniors: calcium. For decades, older adults were told a simple message: take calcium to protect your bones. And bone health is important. But when it comes to the heart, calcium supplements are far more complicated than most people realize. Calcium from food sources like dairy products, leafy greens, and certain vegetables is absorbed slowly. The body can regulate it and direct it where it's needed, mainly into the bones. Calcium from supplements works very differently. When you swallow a high-dose calcium pill, it creates a sudden spike of calcium in your bloodstream. Your body cannot immediately use all of it for bone building. That excess calcium has to go somewhere. One major concern is that it may deposit in the walls of your arteries. This process, known as arterial calcification, makes blood vessels stiffer and less flexible. When arteries harden, the heart must pump harder to move blood through them, increasing the risk of heart attack and other cardiovascular problems. Some large studies have suggested a modest increase in heart attack risk among people taking calcium supplements, while others have found mixed results. The science is still debated, but the concern is real enough that doctors are far more cautious today. What's clear is this: more is not better. Many seniors begin taking calcium supplements on their own, without testing, without medical guidance, and often at doses higher than needed. For people with diagnosed osteoporosis, calcium supplements may still be appropriate, but only when carefully balanced against cardiovascular risk and combined with vitamin D, diet, and medical supervision. The safest approach for most seniors is to prioritize calcium from food, not pills. And if a supplement is considered, it should always be a medical decision, not a personal experiment. Now that we've covered all 5 categories of medications and supplements that can quietly affect the heart, let's bring everything together and talk about what truly protects heart health after 60. Now, let's put everything into perspective. The goal of this video is not to scare you. It's not to tell you to stop taking your medications. Stopping a prescribed drug on your own can be extremely dangerous. The real message here is awareness and empowerment. As we age, the balance between benefit and risk changes. A medication that helped you for years may begin to affect your heart differently after 60. That doesn't mean it's bad. It means it must be reevaluated. One of the most important steps you can take is simple. Bring a complete list of everything you take to every medical appointment. That includes prescription drugs, over-the-counter medications, vitamins, and supplements. Then ask clear, direct questions. Is this medication still the safest option for my heart? Could it be affecting my blood pressure, heart rhythm, or fluid balance? Are there safer alternatives at my age? Should we monitor anything regularly? Many heart problems in seniors don't start with chest pain. They start quietly with fatigue, swelling, dizziness, shortness of breath, or balance issues. These symptoms are often blamed on getting older, when medications may be playing a role. Another key point is combination effects. One drug may raise blood pressure, another may cause fluid retention, another may interfere with minerals your heart needs. Together, they can slowly overload the heart without any single medication being the obvious cause. Protecting your heart after 60 is not about taking more pills. It's about taking the right ones, at the right dose, for the right reason, and reviewing them regularly. Your heart has worked for you every day of your life. It deserves careful attention now more than ever. In the final moments, let's close with the most important takeaway.